Yeah, thank you, Abigail, for this very apt question. So I would say sequence study is really a landmark trial in the field of Crohn's disease, because this is really a head-to-head trial that's addressing an unmet need that we have in the treatment of our patients with exposure to anti-TNF therapy. And this is really a common clinical problem that we have, because I'm glad that I'm practicing in these times where I have a lot of therapeutic options. I think that is great. But even here, I have, especially in the setting of previous anti-TNF failure, where we already know these are hard to treat patients because failure to anti-TNF is like a surrogate marker for severe disease, hard to treat disease, refractory disease. So having these biological options is very fine. But of course, now choosing the second advanced therapy, you have to make the right choice, because this really matters for the patient, because we know the more failed therapies we have, the higher is the likelihood of a very complicated disease course. So I would say this sequence study with this head-to-head trial design comparing the efficacy and safety of risankizumab and ustekinumab is very important, because I think also in the setting of this trial, it's looking, of course, at the 48 weeks, looking at the defined primary endpoints also, but it also goes beyond that and looks at the durability of the treatments. So I think these are the two components that we need to make our treatment decisions. What is better in a direct comparison, because ustekinumab and risankizumab are two valuable treatment options, but we want to choose, of course, the best treatment option for our patients. And then also not just to study how efficacious is it in a short time, because Crohn's disease is a chronic immune-mediated lifelong disease. We also want to see with the initial responders especially, how long does this response, or in this case even remission, hold on, and what can we expect from the substance. So I think hopefully I got to the point what indeed makes this trial so significant for us and also valuable in daily clinical practice. I think the long-term durability that we have undoubtedly seen, or are seeing, as I may say, because it's an ongoing study also, with risankizumab is really significant for us. Because what we see in clinical practice is that often initial responders to a therapy where we think all is good now, lose response to therapy over time. So effectiveness is diminished or even is lost, and we have to change the therapy. So of course we are interested in short-term results, but we also want to see in how far does an initial response hold on in this individual patient. How can we really achieve sustained effectiveness over time in this lifelong immune-mediated disease? And here, of course, looking not only on clinical markers, but also on objective disease parameters, for instance, especially endoscopy, is very valuable to us, because from my point of view, this is the most telling and relevant endpoint, especially in Crohn's disease, where we know there might be even a disconnect between clinical symptoms and endoscopic disease activity. So for me, this is really the long-term durability, and especially, we should not forget, challenging patient population with previous anti-TNF failure is very important for me. So that is something with this ongoing study, and of course now 3-year treatment results. This is really underlining what we can expect from this therapy, also in daily clinical practice. So for me, this is a perfect setting that needs to apply to every drug that wants to prove its effectiveness to us. Yeah, I think because we are all looking for predictors of sustained effectiveness. I'm also doing research in the molecular field, but we have not found anything yet. And I always tell everyone and also my colleagues, the best predictor for sustained effectiveness is early response, early remission. So especially these data are also underlined by the open label study with risankizumab, because we see, as you just mentioned it, with week 8, week 48 clinical and endoscopic remitters, that this is a very good predictor for sustained effectiveness. So if you have this sustained therapeutic effectiveness early on, also over the first year, for instance, this is the best predictor that you can really expect, also with the highest and, let's say, most telling endpoints that we have in our field in Crohn's disease, which is endoscopic response, endoscopic remission, is sustained over a long time treatment period. So for me, these studies are really showing us that, for instance, this short term, and 1 year is not short, but already shows sustained effectiveness, is the best predictor that we can really count on this drug for a long time in this hard to treat disease. That's a very good question because indeed, what do these data tell us? And for me, they are indeed sort of a guiding light also in my daily clinical practice. Where can I place a certain substance, of course, in this case, risankizumab, in my personal treatment algorithm? So for me, these data with sustained therapeutic effectiveness, with excellent endoscopic healing data maintained over time, this is something that's important for me, clinical effectiveness. And we also have safety data that are also recorded. So this tells me that risankizumab indeed is my first choice in anti-TNF exposed patients. But of course, beyond this treatment group, also from daily clinical practice, you see excellent results also in therapeutic naive patients. So of course, you extend your indication that you're using risankizumab in. So for me, I do not really see a patient population that does not fit for initiation of risankizumab therapy. And especially the sustained therapeutic effectiveness that we are seeing now in, for instance, this 3-year open label data really encourage me to use risankizumab early on in my treatment algorithm, but also that's a therapeutic option for the so-called hard-to-treat patients that we at our tertiary center especially see in a high frequency, because here risankizumab has shown its effectiveness also in these patients, for instance, with prior anti-TNF failure, like in the sequence trial, because these patients are indeed also fulfill all the criteria of hard-to-treat refractory Crohn's disease patients. And with the amazing treatment results that we see in the sequence study and the sustained effectiveness seen in the open label extension studies, this is really something that helps us to position risankizumab high up in my personal therapeutic algorithm.